What inspires us to do the work that we do? And so personally, I think my inspiration comes from my personal commitment to end oppression and inequities, and from a keen sense that it's our systems and institutions that are perpetuating these inequities every day. And it's important for me that we work together to do this, life-changing and system-changing work that needs to be done. And I wanted to share with you an experience. I've had the privilege of being able to work with Indigenous people across this country, and a lot of my formative time was spent in the Cowichan Valley on Vancouver Island with Coast Salish people, particularly the Cowichan. And in some of the work that we were doing around this, we asked one of the knowledge keepers to come up with some of the words in the traditional Hulkaminam language that could describe what we were doing. And Irma was always enthusiastic of uncovering words. Hulkaminam language is quite threatened in terms of its disappearing. And she found this word, and it reminded me that an elder always told us, English words have such little meaning, our Indigenous words mean so much more. And so she brought forward this word to describe our work that was sahansawakwa, which meant people coming together to work on a common purpose. And it's really nice to be in this space where I feel like that's what we've created in this space here. I really love the way that you brought everyone together as an artist, an activist, a civil servant. I feel like I'm all of those, and at different times, one is stronger than the other. And, I grew up in a family where my mom was an artist, and I decided I really needed a real job so I could afford to feed my children. So I kudos to Melanie for making it work as an artist in life, because that is my dream, and I figure that's what I get to do when I retire, although I do try to bring it into the work that I do now. I've also spent time as a civil servant. I worked with the First Nations Health Authority in British Columbia, as well as with Health Canada before I moved here, and focusing on really how do we make change in the system. And what I really saw that needed to be focused on was that there's structures that shape healthcare experiences. And I know we're talking about health, but my research is looking at healthcare and people's access to healthcare, and how do these structures shape people's experiences when they access healthcare? And in particular, what about for marginalized populations? And I use that term deliberately because I want to unpack it here, that we need to really focus on moving beyond focusing on individuals and individual care providers, and also marginalized populations that understand that people aren't inherently marginalized. It's our systems that are marginalizing people, and that's where we need to focus on our systems. And so just to give an example, in my research I really focus on we need to understand our relationships with each other within this context of social, economic, and political spheres that shape how we interact with each other. And it's part of this debate around structure and agency, and there's structures that form what we can do, yet we have agency to make change, and how we're going to address that. And I provide an example of how we don't provide adequate interpretation services in our hospital system. So that's just one thing I start off. And I question, why is it that we don't provide that service, that it is seen as a basic human right in this country? And part of it is in the social context. I've seen it where not everybody has the same commitment to equal access to healthcare and feels that maybe we don't need to do that. At the same time, I've seen people who said, people should learn English if they're going to be here in our country. And those are social values that shape that experience in the healthcare system. Also in the economic context, what are we actually funding in the healthcare system? We have a cap on our interpreter services. So if we've hit that cap, there's no more money for the rest of the year. That doesn't always dictate how it's done, but I think we do see that where we spend our money is an example of what our commitments are and where our commitments lie. And for me, this is one of the things that's a real challenge about living in Canada. Whenever I go abroad, people always think that we have the best healthcare here, the best multicultural diversity in this country, and I do feel that is something that defines us as Canada. Yet I strongly feel like we say things that then we don't actually do in practice. And Canada, I think, is particularly good at saying things that we don't actually do. And so what I looked at in my PhD research was around these questions of how do we value diversity within the healthcare system, and how are we responding to the needs of diverse populations in healthcare? And what I see was that big disconnection between what we say we do. We say everyone has equal access to healthcare services. We say we have the best healthcare system in the world. We say we have multicultural institutions that are reflective of the diversity in our population. And what I saw is that, no, that's not the case. Our institutions are not representative of the populations that we work with and the populations in this room. And what I saw in particular was that we really have we focus on populations who are excluded without looking at what are we doing that's excluding these populations. And so one of the things, when I was working in British Columbia, I worked with the First Nations Health Authority, and there was a different policy context in British Columbia where Indigenous health was a priority, and we had a new political agreement that said that First Nations people had the right to determine what their healthcare services were like. So we were really moving forward on that agenda. And I was really glad to be part of it as a civil servant, because in academia, I spent my time researching this, saying, wouldn't it be nice if we did this work? And all of a sudden, I'm in an organization where that's my job, to push this work forward. So it was really exciting times to be in British Columbia, where I could go to the Regional Health Authority, so equivalent to the LHINs here, and say, this is your responsibility to address this problem. What are you doing about it? And then I moved to London. That was 5.5 years ago, and I have to confess, and I don't mean to insult anyone here, I felt like I went back in time, like maybe to the 50s. Okay, part of it maybe I was appointed to the medical school, so I was in the medical school, and I've been appointed to psychiatry and pathology, and I am a social scientist, and I don't know why I'm there, but I found myself hanging out in the hospitals, and I went to some of my leadership in the hospital, and I said, so what are we doing to address Indigenous health equity here in the hospital? And they looked at me like I was crazy. Like, sorry, no, we're a hospital? That's not really our thing, right? We don't really do equity, we provide healthcare. And so I was really surprised that it was completely not on the agenda to address the barriers that Indigenous people are facing in healthcare when I moved here to London. And I'm happy to say that I think things have changed a little bit, but I'll tell you a little bit about what I found. The other thing is that I was in the Department of Psychiatry. That's my home department in the Victoria Hospital. And there was an initiative going on at the time to address immigrant and refugee access to mental health services. So I don't know if some of you in the room were probably involved in that work, but before I came to London, there was a Seeds of Change project going on. People might be familiar with that really brought forward what communities were saying is not happening in the healthcare system in terms of meeting the mental health needs of immigrant and refugee population. And so I thought, all right, I'm going to make that into a bigger research project and find out what's actually happening in our healthcare system here in London. So I had 2 projects that I was engaged in, looking at immigrant and refugee mental health, and then Indigenous people's experience in healthcare. And I did get advice from a number of strong Indigenous health leaders here in the community about what to focus on. And so we looked at maternity, diabetes, emergency, mental health, and cancer care. And what we found is that what I see happen in the healthcare system is we often problematize culture as if there's cultural barriers in access to healthcare. And one of the things that I see is that we were only problematizing the non-white, non-English, non-European communities as if somehow their cultural practices were the barriers to access in healthcare, because their beliefs were incongruent with the way that we do things in the healthcare system. And what I found important to do in my work was to refocus our attention back on those institutions, saying, what's the culture of these institutions that are making everyone so unwelcome here? What is it that we've embedded within our organizations and institutions in Canada that make them hierarchical, Western-centric, Eurocentric, and exclusionary? And really focused our light on those are the challenges within, cultural barriers to healthcare, is the institutions that embody those values that really I don't think should be acceptable in terms of what we see as values as Canadians. So I'll share with you some of the findings that I had in my study. Indigenous people have a really terrible experience in our healthcare system in this city, really terrible experience. Cultural values are not accepted, are not made, there's no space made for that within our institutions. Stereotypes around Indigenous people are very strongly held within our healthcare system. I work really closely with an Indigenous patient navigator in the system, and she's saying that almost every single file on Indigenous patient says that they are suspected to have abuse issues and drug abuse issues without ever having that conversation with that patient or their family. So we see these stereotypes really impact the care that people receive. We see people being blamed for the health conditions that they have, that there's an assumption that this culture of poverty that's been enforced by a colonial system is the culture of Indigenous people, and somehow that those are choices that people are making about not having access to good food and good housing and recreational activities and infrastructure within their communities. What I see with the immigrant and refugee research as well is that cultural norms are not accepted in the healthcare system. Our healthcare system is very oriented around an individualistic approach and isn't favorable towards family and communitarian values. And so we don't have the systems in place to provide that care for an entire family. And also that mental health was quite influenced by cultural values, and that a lot of that is lost in translation. So we do have interpreter services in the hospital, and one of the things that I found really challenging is that we only do language interpretation. We don't do cultural interpretation, and I feel like that's what care providers really wanted. They want to know what is it that people believe in, and what are people's values and experiences, and how do we make sure that that informs the way we deliver care. So in 45 seconds I have left, I want to tell you what does this inspire me to do. So I teach at the university, I teach medical students, and I teach in public health, and I teach my students to think differently about culture and our institutions, and to focus on inequities and understand that other people's beliefs and stories and experiences and values are important as an evidence base, and that racism and social exclusion is a determinant of health, and that we need to address these and call them out. I use forum theater as well, so I was so happy to hear about the work that others are doing that. I use role play and storytelling to have our students kind of get in the space of what it's like being someone oppressed within our healthcare system. And so the call to action that I have for you is that when you see racism and discrimination embedded in our institutions and our practices and our policies, call it out. Say that this is unacceptable. This is not in line with what the values that we have in our society, of a democratic society that demands equity and equality to move forward. Make sure that we use that equity lens to analyze decision-making and policies, and I think that's something that's going to be really in the fore as we transform the healthcare system under this new Rob Ford government that's for the people, but not necessarily for all the people. So, I encourage you to demand better of our institutions, have expectations that, we actually want to see equality in our systems. This needs to be mandated. Organizations need to be held accountable. We get so stuck in rhetoric in Canada. I think that's where we're very good. We say all the right things and change nothing. And what I call for you is say the right things and demand that our institutions do the right things. Thank you very much.